Authorities in Macedonia have sealed off a hotel where a British man has died from symptoms of the Ebola virus. A health ministry official says the man had arrived from Briton on October the 2nd. A few hours later, he rushed to hospital where he died later. Now, a doctor of the ministry's Commission for Infectious Diseases says the man had been suffering from fever, vomiting and internal bleeding, and his condition deteriorated fast. She also added that the health officials have taken strict measures to make sure that no more people are infected with the deadly virus.
Because of all this, we are not allowing anyone into the hotel where he stayed, and everybody who was inside the hotel has been put in quarantine. Also, all hospital staff who were in contact with the patient have been put in quarantine and will remain isolated until we get the results of the tests. We are now waiting for the first autopsy results and have to wait for the results of the samples we sent to Germany for testing.
Let's cross over to Sierra Leone. Joining us via Skype is Margaret Harris, a communications officer with the World Health Organization. Many thanks for joining us here on Press TV, Ms. Harris. Now, we saw cases in the U.S., then Spain, and now even in Macedonia. How troubling do you find the fact that this virus isn't being contained in West Africa?
It's certainly well ahead of us, and it's certainly an effort that is stretching not just our organisation but all organisations to the limit. The fact that these cases are being identified, or suspected cases are being identified in different parts of Europe, in some ways is a good thing. It shows that the systems are very much on alert. We declared a public health emergency of international concern in early August, just for this very possibility, to make sure that all countries are very, very aware of the possibility that people could arrive in their countries and to take action immediately a suspect case is identified.
Of course, that action also has to be hit right at the heart of it, where you are in West Africa. How much support is the international community right now giving to agencies like the WHO to contain and combat Ebola?
The support is really beginning to come in now. We're seeing tremendous support from the British. The Cubans have sent 165 nurses and doctors. The Chinese are providing a new laboratory. We've had a fantastic laboratory being run by the South Africans. And we've got the UN mission for the emergency Ebola response, which has started up and is starting up, moving at lightning speed. I've never seen a UN agency move this sort of movement so quickly. So the response is really happening now, but it's like turning around the Titanic. You've got a huge problem. We've got to move very fast to stop it, but we're not going to see that the outcome we all want, which is this outbreak to stop. We're not going to see that immediately. We still have some difficult weeks ahead of us.
And using this international platform here at Press TV, if you could make an appeal for certain things that can help in combating Ebola in West Africa right now, what would it be?
We want people, but we want people who are specialised in certain areas. So we want people who are very practical, like logisticians. Those are people that can bring things to the right place, make things happen, help make sure that the treatment centres and the treatment beds we need built are really built. We need equipment, so we need personal protective equipment, we need medical supplies, we need food to come through the right channels, we need help with transport, we need the international transport networks to be open so that those supplies can get here quickly. And of course we need funding. So if, lots of people can't physically come here, but funding will make that difference. We have to make sure we come with burial teams because they haven't been paid. We need to make sure we can pay people right away. We can pay them for doing the very hazardous work they're doing. We need to be able to pay for everything right up front really quickly so that all the things that need to be done are done.
All right, there you have it. Margaret Harris, Communications Officer with the World Health Organization. They're joining us via Skype from Sierra Leone. Many thanks indeed, Ms. Harris, for your comments here on Press TV, of course.